Hi, my name is Tristan and I'm going to be inserting a urinary catheter today. So the first thing that I want to do is assess my patient for the size of French catheter that I'm going to need. I'm also going to assess them for the last time they voided, if they have any allergies to betadine, which can be used to clean the perineum area, and make sure that in the position that I'm going to place them in for the procedure that they're going to be able to hold that position during the length of the procedure. I will then gather my supplies, which I have all here, and then I'll go into the room, introduce myself to the patient, let them know what the procedure we're going to be doing today is and what it consists of. And then I'm also going to identify them have them identify themselves to me with their name and date of birth, and then I'm going to compare to the name band and adjust the bed to a good working height. After that, I will wash my hands, provide privacy for the patient, and then we'll get them into position. So they're going to be laying on their back in supine position with their legs up like so, and I will provide them with a back blanket to give them a little bit of privacy as well. I will then put on some clean gloves since I've already washed my hands. And then at this time, I want to perform some pericare. For my patient. Just make sure that they're good and cleaned up before we do the procedure because we don't want to get any infections. I'll get rid of that. And I will wash my hands again. And then the next thing that I will do is get my supplies out, and I'll make sure that the French on the kit matches the French that we need for the patient. Okay, I'll carefully open this. Carefully grab out my sterile gloves. I'm going to have a drape in here that I'm going to want to put underneath the patient just to keep it clean. I'm just not going to try and touch the middle part that's going to be closest to the area we're working with of the patient. I also have another drape that is already cut for going around the working area of the patient. Once again, trying not to touch the middle part of it. Just getting it around that spot that I'm going to be working with. Next, I will put on my sterile gloves. Once my sterile gloves are on, I'm going to put this tray in my working area of the patient, and I will open up the swabs that are provided and set them in the tray. And I will also take this time to put my sterile water or my lubrication and test my catheter bulb. My bulb is not leaking, so it's good. I'll also lubricate the tip of the catheter. Now I'm going to clean the meatus of the patient. So using my non-dominant hand, I will spread the area that I'm working with, noting that my non-dominant hand is not sterile anymore because I'm now touching the patient. I will take one swab and wipe the labia farthest away, throw away the swab, wipe the labia closest to me, throw away the swab, and then take the last one and wipe right down the middle of the meatus and throw it away. Once we have done that, we're ready to insert our catheter. So still holding on to the patient, I'm going to get my catheter and take it out. The catheter part will be out here, but the bag part will be out, but the syringe and the catheter part I'll lay in this sterile plate that I have here. So I will then insert the catheter into the urethra. Two to 3 inches. And once I see urine flow, I'll go 2 more inches. At this time, I will then inflate my balloon. All the way. Take my syringe off, throw it in the trash can, and then pull on the catheter, making sure that the bulb is pulled to the edge of the bladder so that it doesn't float around in it. Once that is in, I will take off my sterile gloves, throw them away. I'll wash my hands and put on another pair of clean gloves that I have. And I will take the part of the catheter that's going to be draining fluid and put it, make it stick with tape that they've supplied to the inside of the leg. And then after I'm done, I will go and document.